Hi, this is Kkubeja, and I'm doing my musculoskeletal and spinal assessment on my mother. Say hi.
Hi.
Okay, the first part of the assessment is you just inspect. You look at her skin here, and is it normal? Is there any discolorations? Does she have any issues moving, which she does not? Next, you would palpate the joints. So we'll start with the jaw, the mandibular area, or the temporal mandibular joint. So I'll have her open and close her mouth. Okay. Then open your mouth as big as you can. And then partially open your mouth. And then put your jaw like in and out. All right, now clench your jaw. And now you have to just move your jaw with pressure. Your face looks really funny. All right. So that would be how you assess the temporal mandibular joint. Next, you're looking at the head and neck alignment, which it looks good. You would palpate the sternal-mastoid, trapezius, paravertebral muscles, and you're checking to see if they're firm and non-tender. Any tenderness?
No.
No. See, that's good.
Thank you for asking, Karen.
All right, next we're going to have her rotate her neck. First I'll have you do flexion, which would be down like that, and then extension. Flexion should be at about a 45-degree angle, and then extension should reach a 55-degree angle, which she's doing just fine. And then we'll have you do lateral bending, and each side should be about a 40-degree angle, and then I'll have her rotate. So then I'm going to put my hand right up against her head here and have her push up against my hand just with pressure there. She should be able to do that without issues, which she can. And then I'll do a shoulder inspection. There's no deformities here. They're aligned just fine. There's no swelling. No obvious muscle spasms or atrophy. So if I had both hands free, I would cup my hands both on either shoulder, like so. And then I'd have her shrug against resistance. And she can do that just fine. And I'll have you stand up for just a minute.
On the floor?
Yeah, not on the table.
Well, I didn't know only on the chairs.
So we're going to do a forward flexion, and then abduction would be like this, and then I'll have you do adduction like this, and then external rotation, and internal rotation would be the other way. And then forward flexion, if I had both hands again. And then forward flexion should be about 180, and then hyperextension would be about 50-degree angle. The next thing that we're going to be looking at is the elbows. There's her left elbow and her right elbow. You're doing an inspection first, making sure that they look similar. The range of motion would be good when you have her do flexion. It should be able to go up to 160 degrees. Extension is about 0. There's no pronation or supination. and she should be able to go against resistance. Next we're going to be looking at her hands and her wrists. I see both of them. They're both similar. There's no swelling or anything like that. We're going to palpate them both. There's no, her fingers are all there, all 5 of them, and they're both same size and shape. So I'm going to have you do extension up and extension back. And then I want you to take your thumb and touch each finger with your thumb, like that. Start with your pointer finger and go down, like that. Yeah. And then you should make a fist. And then I want you to put both hands to your back, and then to your front. And that's called the Phelan's test. And then I'll look at your the hips is something you do as soon as you walk in the room. Give me a laugh. And you see if everything's aligned correctly. The hips and the spine do look the same. And you can see that line down the back, that straight line. There's no atrophy in quadriceps here, or muscle spasms, no swelling. And then I'll have her do a squat, see if it's, there you go, stand up. All right, and then we're going to be looking at her ankles and her feet. They're both, all the fingernail beds are not blue. Her nails are fine on her feet, and then there's no evidence of peripheral vascular disease or anything like that. Can you rotate? And then I'll have her rotate the other one. She can rotate both ways. No issues, no crepitus. There is no thoracic curve in her spine. All good there. Lastly, we're going to be doing the neurological assessment, which is done as soon as you walk into the room and you're asking her, you know, where she lives, how she grew up. Just make conversation, make sure that the patient is answering appropriately, and then if you see any abnormalities, like any weakness in either side, you should note that and begin a neurological test and test the 31 pairs of nerves. But she's fine with that. That's it. Thank you very much.